So the reason that the retina is a special place to look for biomarkers, it shares many similarities with the brain in function and structure. So for example, the resident microglia cells that are in the retina, which are also in the brain, the neuronal retinal cells, such as the retinal ganglion cells, of which the central nervous system axons form the optic nerve, and the optic nerve is directly connected to the midbrain. The optic nerve also contains many glial cells, for example, the oligodendrocytes, similar to the brain, but also a function of, for example, the blood-brain barrier, which has a similar structure in the retina, which is the retina-brain barrier. So it's very similar, and this makes the retina the only piece of neuronal tissue which is also outside the skull, where we can directly visualize neuronal tissue in a non-invasive way and on a micrometer scale through light. Of course, the blood biomarkers are on the horizon and are widely discussed. But I think that the blood biomarkers blood is still a derivative from what happens in the brain, where the actual pathology is located. Whereas in the retina, we are actually looking at the neuronal tissue where the pathology is at. So we are actually looking at a large cohort of retinas. We have now up to 100 or over 100 retinas that also have corresponding brain pathology. And the main study, or main aim of our study is that we try to find biomarkers in the retina. And the study that I presented on today is about microglia, if the microglia is a fit biomarker for assessing pathology that is in the brain. And we have data that indeed shows that microglia are increased in activity in neurodegenerative diseases as opposed to controls. So not only in Alzheimer's disease, but also in Parkinson's disease, frontotemporal lobar degeneration with TDP43 inclusions, and in DLB, Parkinson's disease with dementia. So all neurodegenerative diseases, which actually shows us that there's definitely something going on in the retina that corresponds to what we see in neurodegeneration of the brain. So our first study showed that phosphorylated tau was increased in neurodegenerative diseases, especially in Alzheimer's disease and in primary tauopathies, but also in controls that show tau pathology in the brain. So it's post-mortem study, so we're not actually sure if these cases would progress to Alzheimer's dementia, but they do have a Braak stage 1 to 3 tau pathology in the brain. So these controls without dementia also showed tau pathology in the eye. And we don't know if the phosphorylated tau starts and then that causes the microglia to locate there, or if it's the other way around. It's also still not known in the brain, but we do find a correlation between the presence of microglia and phosphorylated tau. So yeah, what comes first is still something to figure out. Yeah.